Hi friends, welcome to Target All Exam. Today let's see the important nursing question paper for all competitive exam. First question, a nurse is providing instruction to a client in the first trimester of pregnancy regarding measures to assist in reducing breast tenderness. The nurse tells the client a wear tight-fitting blouse or dresses to provide support. Option B, wash the nipple and areola area daily with soap and massage the breast with lotion. Option C, wash the breast with warm water and keep them dry. Option D, avoid wearing a bra. What is the correct answer here? Yeah, option C, wash the breast with warm water and keep them dry it is. Next question. Andrea with suspected rheumatic fever is admitted to the pediatric unit. When obtaining the child history, the nurse considered which information to be most important. Option A fever that started 3 days ago. Option B, lack of interest in food. Option C, a recent episode of pharyngitis. Option D, vomiting for 2 days it is. So what is the correct answer? The question is rheumatic fever. Yeah, option C, a recent episode of pharyngitis will be the correct answer. Next question. A nursing instructor asks a nursing student who is preparing to assist with the assessment of pregnant client to describe the process of quickening. Which of the following statement, if made by the student, indicates on understanding of this term it is? Option A, it is the soft blowing sound that can be heard when the uterus is auscultated. Option B, it is the fetal movement that is felt by the mother. Option C, it is the irregular painless contraction that occurred throughout the pregnancy. Option D, it is the thinning of the lower uterine segment it is. What is the correct answer here? Yes, option B, it is the fetal movement felt by the mother. That will be the correct answer. Next question. A nurse midwife is performing on assessment of a pregnant client and is assessing the client for presence of ballotment. Which of the following would the nurse implement the test for the presence of ballotment? Option A, palpating the abdomen for fetal movement. Option B, auscultating for fetal heart sound. Option C, assessing the cervix for thinning. Option D, initiating the gentle upward tap on the cervix. Actually, during internal ballotment, we are going to do what is that it is? Yeah, initiating the gentle upward tap on the cervix it is. That will be the correct answer. During the vaginal examination, we are doing. Move on to next question. The pituitary hormone that stimulates the secretion of milk from the mammary gland is option A, prolactin. Option B, progesterone. Option C, estrogen. Option D, oxytocin. So usually for the which hormone is going to secrete the milk it is? Yeah, prolactin. What about other hormones? Oxytocin is going to be let down the reflex. Estrogen and progesterone is for regulating the menstruation and also pregnancy. That's why option A will be the correct answer. Next question. A pregnant client is making her first antepartum visit. She has a 2-year-old son born at 40 weeks, a 5-year-old daughter born at 38 weeks, and 7-year-old twin daughters born at 35 weeks, and 7-year-old twin daughters born at 35 weeks. She had a spontaneous abortion 3 years ago at 10 weeks and using the obstetrical score that is gravida, term, preterm, abortion and live birth format. The nurse should identify the client is. Actually, what is the obstetrical code? We are going to be assessed for that. Option A, gravida 5, term 2, preterm 2, abortion 1, live birth 4. Option B, gravida 5, term 2, preterm 1, abortion 1, live birth 4 it is. And option C, gravida 4, term 3, preterm 1, abortion 1, live 4 it is. Option D, gravida 4, term 3, preterm 2, abortion 1, live birth 4 it is. What could be the correct answer? Can you guess it that? Yeah, totally 5 pregnancy is coming and the term birth was happen in 2 it is 38 weeks and 40 weeks. That is why term 2 it is. So totally how many pregnancy? 5 pregnancy, 40 weeks, 38 weeks, 35 weeks and 10 weeks and current pregnancy. So totally gravida will be 5 it is. And preterm, how many babies are born? Twin daughters at 35 weeks. That is only one delivery. So that is why preterm delivery is 1. And how many abortion was happen? It is, yeah, totally how many abortion it is? That is 1 abortion. So totally what is the correct answer here? Yeah, option B, gravida 5, term 2, P1, A1, abortion 1 and live birth 4 will be the correct answer. Next question. In a lecture on sexual functioning, the nurse planned to include the fact that ovulation occurred when the option A, blood level of LH is too high, option B, endometrial wall is slough off, option C, oxytocin is too high, option D, progesterone level is high it is. So what would be the correct answer? Usually oxytocin and progesterone is helping for the pregnancy only. And endometrial wall is sloughing off means that is related to the menstruation. During every menstrual cycle, endometrium is going to be slough off it is. That means during the sexual function, the ovulation is going to be stimulated with help of the luteinizing hormone it is. So ovulation, that is LH. Usually it was happen in the every 10 to 14 days of every menstrual cycle. So what is the correct answer here? Yeah, option A will be the correct answer. Next question. Which of the following symptoms occur with the hydatidiform mole it is? Option A, heavy bright red bleeding every 21 days. Option B, fetal cardiac motion after 6 weeks gestation. Option C, benign tumor found in the smooth muscle of the uterus. Option D, snowstorm pattern on ultrasound with no fetus or gestational sac it is. Okay, fine. What do you mean by hydatidiform mole? It is what we can say that it is one type of the non-cancerous tumor present during the pregnancy. Actually, the fetus is converted into the non-cancerous tumor it is. Okay, there is no fetus will be, there is no gestational sac. It's look like a grape-like structure it is. And also when you are looking in the ultrasound, how it was looking there, it was showing the snowstorm pattern of appearance it is. So that means what is the correct answer here? Yeah, option D will be the correct answer. Next question. During a perinatal visit at 38 weeks, a nurse assessing the fetal heart rate, the nurse determined that the fetal heart rate is normal and which of the following is noted? Option A, 180 beats per minute. Option B, 80 beats per minute. Option C, 100 beats per minute. Option D, 150 beats per minute. What is the normal fetal heart rate? It is 120 to 160 beats per minute it is. So if it is 180 means it is fetal tachycardia. 80, 100 beats per minute means what is that? It was called it as fetal bradycardia. So acceleration and deceleration was happened then. So that is what 150 beats per minute will be the correct answer, because 120 to 160 beats per minute will be the normal fetal heart rates. So option D will be the correct answer. So move on to the next question. After the first 4 months of pregnancy, the chief source of estrogen and progesterone is the option A, adrenal cortex, option B, placenta, option C, corpus luteum, option D, anterior hypophysis it is. See, adrenal cortex, where it was there, it is above the kidney. It won't affect the pregnancy. Okay, fine. And corpus luteum, it is related to the menstruation it is. Anterior hypophysis, it was present in the brain it is. So what is the correct answer here? Placenta, because first 4 months of pregnancy, which is going to be helping for maturation of the fetus, that is placenta only. So option B will be the correct answer. Next question. Your nurse is reviewing the record of a client who has just been told that a pregnancy test is positive. The physician has documented the presence of Goodell sign. The nurse determined this sign indicates option A, the presence of fetal movement, option B, a soft blowing sound that corresponds to the maternal pulse during auscultation of the uterus, option C, the presence of acidity in the urine, option D, a softening of the cervix. It is whenever the first trimester of pregnancy, what will happen? Increase blood circulation to the pelvic areas, all the pelvic floors also. So that is why what will happen? Increased blood circulation to the cervix. It is. So what is happening there? So that is why cervix looks like a very softened during the physical examinations, that is vaginal examinations. So that is opening of the cervix will be there. That is why it is called it as Goodell sign. It is. Next question. A nurse is caring for a pregnant client with preeclampsia. The nurse prepare a plan of care for the client and document in the plan if the client progress from preeclampsia to eclampsia. The nurse first action is what is that? It is usually what it may be preeclampsia. That time your BP, the pregnant mother is having high BP, there is no fits. It is okay, fine. And during eclampsia, high BP with the, it is going to affect the seizure attack, that is fits is going to be, convulsion will be there. So that is why what you have to do for the eclamptic patients, it is what is the priority it is needed. Option A, administer oxygen by face mask. Option B, clean and maintain the open airway. Option C, assess the blood pressure and fetal heart rate. Option D, administer magnesium sulfate intravenously. Actually, the given 4 answers also it is correct only. But what is the priority we are going to do? First, we have to check the open the airway, clear the airway it is. Second, we are going to administer the oxygen. Next, we are going to assess the blood pressure and fetal heart rate for the mother. Along with next, what you are going to do? You are going to administer the magnesium sulfate for controlling the BP it is. So that is why we have to check which is the order for the criteria it is. So that is why option B will be the correct answer. If you want to prepare AIMS, RRB, ASIC, MRB, TNMRB or CHO, NHM, whatever the exams if you want, you can download. Free app is available in the Target Alga exam. So you can download it and utilize it. And also you're having so many live exams and also you're having the current affairs available. So watch it out in the Play Store Target All Exam app it is. Okay, fine. Next question. At a prenatal visit at 36 weeks gestation, the client complains of discomfort with irregularly occurring contraction. The nurse instructs the client to option A, time contraction for 30 minutes. Option B, lie down until they stop. Option C, walk around until they subside. Option D, take 10 grains of aspirin for the discomfort. So every mother has to know. So during the 9th month of pregnancy, you will get a Braxton Hicks contraction. That is irregular uterine contraction will be there. That is normal for every mother it is. So whenever you are getting the contraction, you will change the position, maybe sitting or maybe lying or standing position, or you can walk also. That is why changing the position, it will be helping to mother for relieve the Braxton Hicks contraction. That's why option C, walk around until they subside, will be the correct answer. Next question. When involved in prenatal teaching, the nurse should advise the client that an increase in vaginal secretion during pregnancy is called leukorrhea and it is caused by increased option A, metabolic rate, option B, production of estrogen, option C, supply of sodium chloride to the cells of the vagina, option D, functions of the Bartholin gland it is. So what could be the correct answer? Why it is happened leukorrhea? During pregnancy, because of the increased hormone production, it will increase the blood circulation in the vagina and cervix. Which hormone is helping for that? That is estrogen hormone is helping to produce the more what is that it is secretions, vaginal secretions. So that is why you will be getting the liquoria. That is normal during pregnancy. That is normal also. That is why option B will be the correct answer, that is estrogen. Next question. A prenatal nurse is providing instruction to a group of pregnant client regarding measures to prevent toxoplasmosis. I need to avoid touching mucous membrane of the mouth or eyes while handling raw meat. Option B, I need to cook meat thoroughly. Option C, I need to avoid contact with materials that are possibly contaminated with cat feces. Option D, I need to drink unpasteurized milk only. So what could be the correct answer? Can you guess it? That it is yeah. If you are drinking unpasteurized milk, you will get a what is that? Toxoplasmosis. That is why you have to instruct the client, don't take unpasteurized milk. It is you have to boil milk only. You have to take like that. You have to instruct the client. It is okay, fine. That is why option D will be the correct answer. Download Target All exam app. You will get all the question and answer current affairs also. Next question. The antagonist for magnesium sulfate should be readily available to any client receiving IV magnesium. So which of the following drug is the antidote for magnesium toxicity is? Option A, hydralazine. Option B, argacho gam. Option C, nargan. Option D, calcium gluconate. So during pregnancy, which is not only pregnancy, so usually magnesium sulfate it is we are giving for the drug of choice for what is that? It is pre-eclampsia and eclampic patients. So that is why if we are giving antidote, that is calcium gluconate it is. So if you are how to administer calcium gluconate? Yeah, only through IV 3 to 5 minutes we have to give very slowly 10 ml of calcium gluconate you have to administer. Afterwards you have to check the deep tendon reflux. Don't forget, you have to check the knee reflux and deep tendon reflux. You have to be check it out. It is okay, fine. Next question. A pregnant client call the clinic and tell the nurse she is experiencing leg cramps and is awakened by the cramps at night. You provide relief from the leg cramps. The nurse tell the client to option A, dorsiflex the foot while flexing the knee when the cramps occur. Option B, plantar flex the foot while flexing the knee when the cramps occur. Option C, plantar flex the foot while extending the knee when the cramps occur. Option D, dorsiflex the foot while extending the knee when the cramps occur. Why the leg cramps is happen? That plantar flex the foot only, you will be getting the what is that? Leg cramps it is. That means what should do that? You have to do the opposite reaction, that is dorsiflex the foot it is. Why option D will be the correct answer. The 12-year-old boy has fractured his arm because of a fall from his bike. After the injury has been casted, the nurse knows it is most important to perform all of the following assessment on the distal to the injury except. So what are they going to assess like that? And except. Option A, skin integrity. Option B, finger movement. Option D, radial and ulnar pulse. Option D, capillary refill it is. So what you have to check? You have to check the what is that? Finger movement, capillary refill, and also you have to check the nail changes it is. Radial and ulnar pulse also. That means except what is that? It is yeah. Option A, skin integrity will be the correct answer. Next question. The developing cells are called a fetus from the option A, time the fetal heart is heard. Option B, 8th week to the time of birth. Option C, implantation of the fertilized ovum. Option D, end of the second week to the onset of labor it is. So what is the correct answer here? When it was called it as fetus? Yeah, from the 8th week to the time of birth is going to be called it as, what is that it is? Fetus it is. That means option B will be the correct answer. Next question. The nurse recognized that on expected change in the hematological system that occurs during the second trimester of pregnancy. Option A, on increase in blood volume. Option B, on increase in hematocrit. Option D, a decrease in WBC. Option D, decrease in sedimentation rate it is. What could be the correct answer here? Yeah, during pregnancy, second trimester, what will happen? It is blood volume is going to be increased. So that is why decrease in hematocrit level. There is no effect to the decrease in WBC and sedimentations. So the correct answer is option A, increase in blood volume. I think you have understand all the question and answer. If you have any doubt, you can contact us, and also download Target All Exam app. It is available in the Play Store. All the best for your exam. Thank you for watching. Next, see you in the next question.